everybody, it's Liz. Welcome back to my channel. So we're in the middle of flu, cough, cold, gross, junky season. And it's pretty likely that you might be giving your baby or toddler Tylenol, Motrin, even antibiotics, something to help them feel a little bit better. That can be really challenging. So if you've ever had any trouble giving your baby medicine, and you want to reduce the amount of tears that you're having and they're having, this video is going to be a great one to watch. I have years of experience as a peds nurse, so I have given a lot of little ones medicine, and I've found a few ways that make it a little bit less painful for both you and them. I'm going to go get my volunteer and we will get started. All right, so I'm going to be giving Avery some children's Motrin because she has a cold and hasn't been feeling super good and has a low-grade fever. So the thing to start out with that I always recommend is find the smallest syringe you can that's reasonable. So you're not going to want to get one of those big 10 ml syringes. This one holds, it looks like it's about a 3. So she is getting 1.25 mLs. So the smaller syringe is going to be easier to get towards the back of their mouth. So I always recommend not holding down your baby as much as possible because that always makes them real angry. So I usually hold her hand, and you're gonna take the syringe and guide it along the side of their mouth and towards the back and just do a little squirt and then let her swallow. If you have a baby that's gonna try to spit something back out at you, a good tip is to put it in the back of their mouth just a little bit and then immediately blow on their face when you pull it out. So. And she doesn't mind this at all, but it does give them a startle and it causes them to swallow. So if you see she's blinking really fast and then she does swallow, that's a really helpful tool for if your baby is going to spit something back out at you. Sometimes another tip is you can hold it in their mouth like this and let them suck on it kind of like a pacifier, and then they will just keep sucking on it like that until they're done. All right, so that's the easiest way for an infant to give them their medicine. So that's obviously best case scenario. The medicine tastes good, your baby's in a decent mood, and they take it no problem. Now we're gonna go over some tips for if your baby is not in the best mood or if the medicine tastes gross. So Avery wasn't super happy, so she's gonna be in this video with us. Say hi. Hi, everybody. So if you're trying to give medicine that doesn't taste that great to your baby, or it's something and your baby's just like not into it, if they're super cranky, you might have to resort to some different methods than the one I just showed you. One of the best ways for your infant, so 12-ish months and under, is sometimes you can take your bottle nipple and drop the medicine into the bottle nipple. So not the whole bottle, just the bottle nipple. Put it in their mouth, especially if it's more than a slow flow nipple. And it works with a slow flow nipple, but they have to really suck. So if it's anything from like a 2, 3, or 4 size nipple, it's fine. You put it in the nipple and then you just put it in their mouth and they usually will take it. Or you could even put a couple drops in there with it, like 5 mLs of their formula or their breast milk, whatever they're drinking, and they'll suck it through the nipple because they might think it's food. That's a really great one if they're little, like younger than 3 months, because they really don't know at that point. Older babies might catch on to that. For kids that are a little bit older, so like 3 months, 4 months and up, it's helpful to sometimes mix it just in the syringe with a little bit of the food that they're eating, and sometimes they'll take it better that way. You're also going to want to make sure that when you're giving your baby these medicines that you're giving them the best chance to do well with the medicine. And by that, I just mean make sure they have some food in their tummy. Medicines do not like to sit in bellies by themselves. They don't like being lonely. Having that medicine sit in a belly by itself is going to make your baby or toddler throw up. So medicines that are hard on the tummy especially are Motrin. Multivitamins are really rough, and antibiotics. Antibiotics, you almost always want to have some food in there, otherwise they're going to throw those back up for you. You can try mixing something in the syringe if just giving it to them plain isn't working. Another tip is just try to act as calm and like this is no big deal as possible. If you are going into it like, oh my gosh, okay, like Avery, you can do this, you can take your medicine, you're doing a good job. No, they're gonna sense your stress and do it. I like with older kids, I usually go in their room, I'm like, all right, it's time to take your medicine. Conversationally, like while they're watching, be like, oh yeah, like Tony Tiger, here you go, take this really quick. And they're like, boop. That's a good, just real casual. If you don't make a big deal out of it, sometimes they won't make a big deal out of it. Next tip is taste the medicine that you're giving them. I always try whatever medicine, just a little bit on my finger, what I'm giving Avery, so I know like, hey, what could I maybe mix with this to get her to take it better? What does this actually taste like? And so that you kind of just know, and you'll be prepared too of like, sometimes it tastes good but it smells awful, or the other way around. It smells like it's gonna be delicious, but it's gross. It's kind of good to know going into this, like, is this gonna be an easy battle or a rough battle? And again, you can figure out, hey, maybe I can put a little apple juice in this and that would mix well. Or, wow, this is really nasty. I'm gonna have to cut it with something like some of their formula maybe. If it's really bad, usually milk or formula or breast milk cuts it a little bit better than apple juice. Things that have like a fruitier taste, apple juice usually cuts it pretty well. If you have a kid that's a year or older, chocolate syrup, strawberry syrup, any of the syrups are gonna be awesome to disguise really gross tasting things. Or Pediasure. Pediasure is another great one that I recommend all the time, especially for Tamiflu. Tamiflu is the most disgusting thing in the entire world, but I found that Pediasure tends to mask that taste pretty well. Sorry, she's like all over the place. Moving on to toddlers. So toddlers are a challenge because everyone knows toddlers, I mean, if they don't want to do it, they're not going to do it. So again, my number one tip for them is just try to act really nonchalant, like this is no big deal. You're going to take this. If you're hyped up, they're going to get hyped up. Give them options, but the option can't be, do you want to take this? It's if you're giving 2 medicines, do you want to take the purple one or do you want to take the white one? Which one? Give it to them. Ask them, do you want to squirt it in your mouth or do you want me to squirt it in your mouth? Options like that to give them a little bit of control, but not the control of, hey, do you want to take your medicine right now? Because the answer will always be no. So another tip with toddlers and babies is if they're laying down like this, by the way, I recommend with infants always laying them down like this in order to give them their medicine. It's gravity, it goes way better. If they're up, they can like just drool and it comes out. So if you have your infant or toddler and they're really fighting you on it, hold them like this, like down if you can get them to lay down. Squirt it in their mouth in little increments so they can't spit it up. And just apply a little bit of pressure if you see under their jaw. So you're not shoving their jaw up, you're just gently holding their mouth shut and pushing up on the bottom of their throat, and that's gonna make them wanna swallow. So they'll swallow for you. They might not be happy, but they'll do it. And if you do it in little chunks, that's a good way to knock it out. And finally with a toddler, I mean, worst case scenario, if it's something they really have to take, like antibiotics or a medicine they take regularly, I mean, you might have to hold them down and just get it in their mouth and gently but firmly hold that jaw shut. You can blow on their face as well. Sometimes that works with them. But usually, if you try the other methods first, mixing it with something, mixing it with ice cream, anything like that is obviously a better resort than holding them down because that usually results in you crying and the kid crying. But last resort, hold them down, shut their jaw. They will forgive you. Things to avoid. I really do not recommend mixing the medication you're giving your kiddo with like a bottle of anything or a cup of anything because you don't know how much they're getting. Say they leave it on the counter and there's like this much left. How much of the medicine is in that? You don't know. If you're diluting it, just dilute it in like 5 mLs, one of those little syringes, enough to get the flavor, but you know they can get the whole thing. Another thing to avoid is, like I said, acting like anxious or worrying about it. No, you just want to present it as like, hey, this is what we do. You could even give toddlers a reward system. So I've seen parents at the hospital, like you get 1 M&M for taking your meds, all of your meds without any trouble. Or hey, here's your sticker chart. Some kids love sticker charts. Like you get a sticker if you take all your meds without any trouble. And just be consistent. Kids that are given consistency with their medicine, if they're going to be taking this long term, they eventually get with the program and it's no big deal. And you can always tell the kids who's the parents like, oh, it's okay, you can do this, blah, 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 because the kids throw a fit every single time. So what happens if you give your baby this medicine, it goes great and you are so proud of yourself and you turn around and 3 seconds later that baby's like, bleh, and they throw up everything. In the hospital, we generally have a 15-minute rule or less. So if they threw up within 15 minutes of giving them the med, you can redose it. So basically, you can give it to them again, because the thought process is their tummies have not had time to absorb any of that yet, so they just threw it up. If it's been more than 15 minutes, assume that they got something out of it, and you don't want to give them too much, so you kind of just call it a day and move on. But if your pediatrician has other recommendations on that, go with that. One final tip, this is especially useful with toddlers sometimes it's helpful to almost get a tablet form depending on the medicine that you have. If you have a toddler who is, fighting you for your life on taking their medicine, sometimes getting a tablet, crushing it up and dissolving it in something like a little bit of apple juice or formula, anything like that, or even sprinkling it in their food, in applesauce, in yogurt. Yogurt masks stuff really well. You can give it to them that way as opposed to having to give them the liquid. Especially if they're having trouble with the big quantities of like Tylenol or Motrin, we'll crush up the chewable stuff, mix it with some apple juice and tell them it's their special juice, and it tastes really good usually, and ouch. It tastes really good and they'll take it a little bit better. Okay, I think that is it for all my tips and tricks for getting your little ones to take medicine. If you have any questions, anything that's worked really well for you that I didn't mention, please let me know in the comments. If you have any questions about how you would give medicine in specific situations, again, let me know. I'd love to give you some input. Thanks for watching. Have a great day. Say bye.